Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power, and today's topic is on pet therapy. And bringing us this great information is Renee Sauter. She is the manager of Guest Experience Department at Regions Hospital. Welcome, Renee.
Thank you.
I'm so glad that you could join us. And then you have some great guests here with your pet therapy. Mary.
Hi, nice to meet you.
Nice to see you again. Dave, nice to see you.
Thank you.
And of course, we cannot forget Chili and Sasha. And they are part of the pet therapy team. And we're here to educate my viewers and make them aware of this great offering at Regions Hospital, because not a lot of people know that Regions has pet therapy. And I'm sure when they walk into Regions, they're a little surprised when they see the animals. Yeah. And even in Germany, they even have animals that go to restaurants. And that is, kind of took us a little bit back, being from America. But I'm not sure. This is your second time on Knowledge for Wellness, and we are delighted all of you are here again. But I'm not sure they caught the first show.
Sure.
So you, of course, working at Regions, we'd really love for you to tell my viewers your love and your passion and why you went into this line of work.
Sure. I am a social worker by background.
Okay.
And so that's how I started at Regions. I then also have worked with the complementary therapies program at Regions Hospital, and am really passionate about trying to help people get through difficult times, offering lots of different therapies that we can help contribute to their healing journey. And so getting the job as manager for guest experience at Regions brought me into the world of pet therapy through the volunteer department. And so I've learned a whole new program of how to help patients through animals.
Yeah, that's great. Wow. And I'm sure the patients, when they leave and they get to visit with the animals, really, really feel so much better.
Many times it's a real nice, unexpected treat. Someone's in there for surgery or for some illness or whatever their case may be. Really the last thing they think about is that there's going to be these two of our 35 dogs that are going to walk through their doors and say, would you like a visit today?
Yeah.
And so if any of your viewers saw the first episode, there was a wonderful video that really exemplified the patient's feelings about what it's like to visit with a pet.
Yeah, I love to watch them light up when the dogs came in.
Yeah, it's really sweet.
Yeah, that's great. And now let's turn it over to Mary. I would really like for you to share with my viewers your love, your passion, and you spend a lot of time at Regions Hospital with Chili, and the patients really, really are the beneficiaries here. But I'd really like for you to tell my viewers about why you chose to do this.
It's sort of an interesting thing for me. I started doing this probably several years ago, actually, with a different dog, and I've been working at Regions with my dogs for about 4.5 years. I'm a retired nurse.
Oh, okay.
And so it was an opportunity for me to bring two passions together, my love of nursing and my love of dealing with people in the community, and also a way of blending my passion with dogs.
Yes.
It's just a perfect fit for me, and I am just so grateful that I have this opportunity with a dog who's really enjoys doing this kind of work.
Yes.
So it's just been fun and very rewarding for me, professionally and personally.
Yes. Wow. And that's so great, because I saw that when we went to do the extra camera footage, your caring and your compassion. And I didn't know you were a nurse before, but now I see it, because that always seems to be sort of a prerequisite on a person as well.
It really helps. Yeah. It helps me. It's hard for me sometimes to not be the nurse. I have to pull back a little bit periodically and not be the nurse, but it's at the same time gratifying for me to see monitors on people show that the dogs have brought them relaxation.
Yeah.
It's an awesome experience.
Yeah, that's great. Okay. Now we'll talk with you, Dave, and of course Sasha. And Sasha is very well known throughout the Twin Cities. And now, did Sasha adopt you, or did you adopt Sasha?
Well, that's a fun story. Sasha was a reject, actually, sold to a lady in Texas was supposed to be shipped to Texas on the famous September 11th.
Oh, okay.
Planes didn't fly, they didn't take dogs, and the lady said to the guy that had her, give her away because she's too old. So for some reason, we have a reject that has been very successful as a therapy dog. And I'm lucky enough to have found that out and have had the chance for almost 8 years now to watch Sasha do her work and see the reactions and the joys and the comforts and whatever else that she brings to people. And it's been fabulous.
Wow, that's great. And I appreciate your time that you also put in as a volunteer. Yeah. Because I know now that if I were to have a choice, I would love to go to Regions just because of the animals and the pet therapy. And I loved how someone came out of pain for just that short amount of time.
Yeah, it's very important.
Yes. So I want to ask, how did Regions come across this whole idea of the pet therapy?
Actually, it was the idea out of one of our volunteer coordinators who has this very strong love of dogs. And, was very aware of how much joy she received from her pets and how much she shared with her friends and family. And thought, how can we bring this to patients at Regions? The philosophy at Regions is really all about putting the patient at the center of everything that we do.
Right.
And so what better way than to spread a little joy through our friends with pets and help those patients, take a little breather from their current struggle. So.
Yeah. Wow. Now I see 2 different types of breeds here, and also in the footage we had a little poodle because sometimes people feel a little overwhelmed by the larger dogs, and so it's really great that you have that. But I understand there's a few other dogs too. There's 35, I believe.
We have approximately 35.
Okay.
We always have room for more. We have not hit a ceiling for our program yet. We have, numerous requests every day, so it's a sure thing that people are going to be welcomed. But yeah, the pet therapy teams have been amazing. So
Yeah. And how do the patients actually, you mentioned you asked them if they'd like to have a visit from the animals? Are there a few people that might have a little bit of a fear for dogs at all? Or how is it that the patient reacts to the visit?
Sure. The pet therapy team will go to, if we have any referrals, they'll go to the room, gently knock on the door, ask if it's still that they would like a visit.
Sure.
So basically the therapist and the dog are invited into the room by the patient and her family. And if it's not a good time, it's completely fine, and that's, their right to say, this isn't a good time, or no thank you, or, that dog makes me uncomfortable, or whatever the case is. We don't get that a lot, but when they see them, usually the face just lights up and they think, oh yeah. And if we saw the video, they saw how they just made room on their beds and
yes.
I would invite them up. So they all think they're lap dogs. So
okay.
Yeah.
So how does the patient actually then request a visit from one of the animals? Is it that the nurse goes by with some sort of form, or
well,
they're made aware of it?
It happens a lot of different ways. They're very visible in the hospital when they're walking around.
Okay.
And so lots of family members will stop and just pet and ask, what are you doing here? And oh, I have my uncle or my cousin or whoever in the hospital here, and I'd love to have a visit. They had a great dog growing up, or whatever the care, or they're missing their own current pet. So that could be one way. Another way would be that the nurse is recognizing that they're lonely or missing their own pet at home, or the family could ask. And so whoever refers the patient, whether it's the patient themselves or their family, usually goes through the nurse, and they call down to our volunteer office.
Okay. Well, I'm sure a lot of the nurses have a little bit of intuitive and maybe see that the family hasn't visited for a couple of days, or maybe their mood's they just got some bad news. Or something like that. I love the idea that the nurses can also call in.
Oh, absolutely. Anyone is welcome to.
Yeah, that's great. So in regards to the dogs, I understand there's a lot of training they go through for the pet therapy, and what is actually required of the dog as well?
So let's kind of start in the beginning, and the question they get all the time is my dog's a great dog, what's it need to become a therapy dog?
Okay.
And so first of all, a great therapy dog is defined as a dog that's got some good manners already. It's got some social skills.
Okay.
is controllable. That is, you tell it to do something, it does it. It's also very predictable on what it's going to happen. For example, if it's a loud noise, you know what the dog's going to do. If somebody walks up to it, you know what the dog's going to do. And then it's reliable in that it will perform the tasks that you're assigned.
Okay.
With that background as the core starting point, why a typical therapy dog would have 3 or 4 levels of obedience training, starting with puppy training, moving up. It then will have probably a level or 2 of therapy training, and then it takes the famous test.
Oh, okay.
And the therapy dogs at Regions are either certified with Therapy Dogs International, TDI, or Delta Society as a Delta therapy dog. And the basic tests are very similar between the two, but it's how well they get along with people, how well they get along with the environment, then doing the basic skills.
Okay.
We're lucky here in St. Paul that we got the Animal Inn in Lake Elmo and the All Breed Obedience in Woodbury, for example, that conduct the classes and help with the testing and certification, so that people at Regions should know that these dogs are trained and ready to perform as therapy animals.
Okay, that sounds great. And Sasha, of course we saw her shine with not only the staff and the nurses. She's very well trained, and we can show a video clip of actually the nurses putting the food on her paws. That was that was adorable. Well, but does Sasha shine in a certain area of the hospital? Does she like, maybe the cancer area or breast awareness or any of that?
That's a fun question.
Okay.
And if I'll give you 2 different answers.
Okay.
By far, her 2 favorite places are radiology.
Okay.
And I think the reason she likes that is the staff is very interactive with the dogs. And then her second place, or first, I don't know really which one's on top, is behavioral health. And I think there the patients are more physical and they're interacting and pet harder and firmer and more like a real pet and talk to her and so on. So those are her favorite places. On the other hand, I think she probably performs the best with some of the sicker patients and palliative care in that she can find a patient and lay by that patient for an hour or 2 and never move and just let the patient pet and you watch, you'll notice that the breathing gets in sync with each other and you watch that the patient's hands might just barely move even though she's asleep and that brings the palliative care in particular, I think, to the patient it's definitely had an impact, but that's an area that also has impacted family when they're struggling with some tough issues and they got a big old fluffy white dog, the pet, that's willing to beg for more pets. So, that's her favorite and what I think she's best in. But she visits everywhere.
Yeah.
She's a trooper.
Yeah. And I know I saw how excited the family gets knowing that Sasha's going to come that day as well.
Yes, lots of people have met her, so her reputation, which I hope is basically good, is has preceded her many times.
Wow, and the joy that you must feel after.
Absolutely.
That's
when you
amazing.
get a phone call from the family that I didn't even know they knew my name after a visit, and the thank you, you've had an impact on somebody.
Yeah.